You know, we use apps for pretty much everything these days. Ordering food, tracking our workouts, even meditating. But can an app really change your life? Like, fundamentally change your health behaviors in a way that could actually save lives? Well, today, we're going to find out.
So let's just get right to the heart of it with a huge question. Can the tech that we all carry around in our pockets actually be a serious weapon in the fight against diseases like HIV? I know, it sounds a little bit like science fiction, but you'd be surprised how seriously researchers are taking this. And to really get why, we need to understand the incredible scale of the problem they're trying to solve.
Just look at this number. Over 1 million. That's how many new sexually transmitted infections happen every single day around the world. That number is just staggering, right? And it shows that as important as our traditional prevention methods are, they could definitely use some backup. And that's exactly why health experts are looking at technology for help.
So that brings us right here. We're looking for a modern solution to a problem that's been around for a very long time. I mean, think about it. Almost everyone has a smartphone. That's a massive opportunity to deliver health support that's private, that's personalized, and on a scale that we've just never, ever seen before.
Okay, so the official kind of sciencey term for these things is Digital Behavior Change Interventions, or DBCIs for short. Now, these aren't just, informational websites you read once. We're talking about interactive programs, apps, websites, even text messages that are specifically designed to actively help us change our behaviors for the better. But the big question is, do they really work? To figure that out, researchers did something really smart. Instead of just doing one more study, they gathered up all the high-level research that already existed to get the biggest, clearest picture possible. Let's just take a look at the mountain of data they had to sift through.
So they started with 23 systematic reviews. Now, each one of these is already a huge summary of a ton of research. So what we're looking at is a review of reviews. It's an incredibly powerful way to get to a really reliable answer.
And inside those 23 reviews, they found a grand total of 514 separate individual studies. This is the real raw data, the original experiments and trials that make up the foundation of everything we know on this topic.
But this is the number that really matters. All of those studies, taken together, involved more than 129,000 people. So this is not some small experiment. We're talking about a massive body of evidence from a huge, diverse group of real people. So what did all this data actually show?
Well, it turns out the answer wasn't a simple yes or a simple no. It's never that easy, is it? The results were surprisingly mixed, and honestly, this is where things get really interesting. It seems that what you're trying to change makes a huge difference.
Check this out. On the one hand, the evidence shows these digital tools are actually pretty good at getting us to do things like schedule an STI test or learn more about HIV. They're good at those logistical behaviors. But on the other hand, when it came to changing more complex, in-the-moment behaviors like consistently using condoms or actually bringing down the number of new infections, the effect was a lot weaker. So what gives? Why the difference?
This is the part where we get to be detectives. We're cracking the behavioral code to figure out what really makes a difference. And to do that, we need to talk about the active ingredients inside these digital tools.
Okay, so the key to this whole puzzle is something called a behavior change technique, or a BCT. Basically, it's a very specific, defined part of an app or program that is designed to target the psychology behind why we do what we do. It's the how that actually makes a change stick.
And this analogy is just perfect. Think about it. An app can have a beautiful design, it can be full of great info, but if it doesn't have these specific psychological tools, these BCTs, it's basically a placebo. It looks the part, but it won't actually have a real effect. The BCTs are the active ingredients that make the medicine work.
So the big question is, which of these active ingredients are the most powerful? Which ones really move the needle? Well, the research pointed to a few specific techniques that consistently got results when it came to STI and HIV prevention. And here is the blueprint. 3 BCTs really stood out. First, goal setting. This is just helping someone define a clear, specific health goal. Second, feedback on behavior, letting them know how they're doing. And third, prompts and cues, which are basically just simple reminders to do something, like go get that test. These 3 have really strong evidence behind them. And you've already seen all of this stuff in action, probably today. That little notification from your fitness app to get up and move, that's a prompt. Earning a badge for working out 3 days in a row, that's feedback. Deciding you're going to walk 10,000 steps today, that is classic goal setting. The best health apps are already using these proven psychological tools.
So let's pull all this together. Where does this leave us? Well, we started with this kind of confusing picture of mixed results, but now we have a much clearer path forward for building digital tools that can actually make a difference in public health.
And this, right here, is the single most important thing to take away from all of this. The magic isn't in the tech itself. It's not the app that matters. It's the proven, evidence-based psychology that we build into the app. The tech is just the delivery system. The real medicine is the behavior change techniques.
So what this research really gives us is a blueprint, a playbook for making much smarter, much more effective health tech. We know it works. So the final question is a much bigger one. Are we ready to take this knowledge and build these tools? And, just as importantly, make sure that they get to everyone who needs them.